The Twin Towers were completed in 1973. They were each 110 stories tall, supporting 50,000 workers, and on an average day, 200,000 people would visit. On September 11, 2001, 400,000 tons of structural steel came down within 3 hours of being hit. The resulting cloud of dust and debris was the major cause of respiratory difficulties that plague New Yorkers today. 9/11 was an unprecedented terrorist attack on American soil, resulting in over 3,000 fatalities and extensive environmental damage. Ground zero for these attacks were in Manhattan at the World Trade Center, better known as the Twin Towers. Two airliners crashed into the Twin Towers, causing them to collapse within 2 hours. 4 buildings later collapsed, and 32 buildings sustained moderate to major damage. People experienced traumatic injury from debris. Their lungs were exposed to irritant dust, smoke, and gaseous material, much of which was alkaline. World Trade Center rescue and recovery workers after 9/11 documented high levels of respiratory symptoms, severe persistent cough, reactive airway disease, asthma, and decreased pulmonary function. As a result of the attacks, people experienced depression, anxiety, substance abuse, and PTSD. They witnessed a horrific deaths of family, coworkers, and thousands lost family members. The people who lived in Lower Manhattan were subject to the daily stress that continued during the recovery period. The debris has been removed since the time of the attacks. Where the Twin Towers once stood now stands the Freedom Tower, a memorial to those lives that were lost. While we may have fixed the environment, the damage done that day remains. Many people have chronic respiratory problems and mental health problems that we're still dealing with today, over 15 years after the attacks. There were many physical health effects that resulted from the Twin Towers collapsing. A majority of these health effects were related to the respiratory system because of all the dust that was associated with the towers falling. Nearly 50% of people living near the World Trade Center cite they had nose, throat, or eye irritation. Hospital admissions spiked significantly in Lower Manhattan in the first week after 9/11. Even years after the attack, people are still having problems related to all the dust. 8% of residents claim that they were newly diagnosed with asthma 5 to 6 years after 9/11 occurred. A study of nearly 2,000 people exposed to World Trade Center dust who sought care at the World Trade Center Environmental Health Center 5 to 7 years after 9/11 showed high rates of respiratory symptoms, including persistent shortness of breath, cough, and sinus or nasal problems. While pulmonary function was normal for the total group, about one-third had below normal pulmonary function similar to the level found in World Trade Center rescue, recovery, and cleanup workers. Abnormal lung function was found among Lower Manhattan residents who reported persistent respiratory symptoms 7 to 8 years after 9/11. Even 6 years after 9/11, an association was found between chronic World Trade Center exposures and lower respiratory symptoms. Of the people enrolled in the World Trade Center Health Registry who had reported either lower respiratory problems or PTSD, more than 25% said they had both conditions 5 to 6 years after 9/11. Respiratory problems aren't the only physical health effects that resulted from the fall of the Twin Towers. Cardiovascular and cerebrovascular disease admissions increased about 2 to 3 weeks after 9/11. Lower Manhattan residents, workers, and passersby with intermediate or high exposure had elevated all-cause and heart disease mortality risks compared to those with intermediate to low exposure. Between 2007 and 2011, 9/11 rescue workers had an 11% more cancer cases than the general New York State population. Rescue workers had more cases of prostate and thyroid cancer, while survivors suffered more from breast cancer and non-Hodgkin's lymphoma. There are many people who were and still are affected by the collapse of the World Trade Center. 14 years after 9/11, there are more than 70,000 patients enrolled in the World Trade Center Health Program, and nearly 21,000 of them are specifically getting treatment for conditions caused by the toxic and hazardous air following the terrorist attack, according to the program's administrators. Workers were exposed to chemicals like asbestos, carbon monoxide, hydrogen sulfide, crystalline silica, and other metals and particulates. More incidents of post-traumatic stress disorder and alcohol use were noted in affected individuals after the 9/11 attacks, and that two-thirds of those affected developed a co-occurring substance abuse disorder. Looking at those victims a decade later, one study found that there was an increased risk for binge drinking. Binge drinking fell into two categories in this study: low intensity of 5 to 7 drinks for men and 6 to 4 drinks for women, or high intensity of more than 8 drinks for men and more than 7 drinks for women on a single occasion. Participants of the study were given 3 surveys to complete, and about a quarter of those surveyed had 1 or more binge drinking episodes in between the second and third surveys. Binge drinking was reported by 24.7%, with 36.9% of those reporting high-intensity binge drinking. Incidence was more likely among males aged 18 to 24 years, non-Hispanic white, and with annual income greater than $75,000 who were rescue or recovery workers, high exposure, or PTSD due to the attacks. An area for improvement can be seen in post-event screenings, population-based interventions aiming at reduced alcohol consumption, and therapies targeting substance abuse and PTSD together. There were many consequences from the 9/11 attacks, including physical ailments, higher incidence of mental illnesses, and environmental destruction. While this attack shook the country, America stood together to rebuild and reshape from the ground up.